Thanks for inviting me in this very great session, and I got many messages. So today, my topic is also around the uh, developing the guideline-based CDSS for COVID-19. So there are many things, many works that are related to the previous presentations by Robert. So this is a very brief introduction of me and my group. So I will not replicate the introduction because just now already the chair already have introduced me, and the left bottom picture shows the group of my lab, and the right picture shows where my university is. It's actually in the east of China. It's located in Hangzhou, a city near Shanghai. And the two pictures show the campus of our university. So I will explain the motivation of my research. So, as the first country to report the COVID-19 cases, China has conducted the related research very early, and actually the COVID-19 is now, it's very serious now. It's so far there are already over 14 million global cases. So so of course there are lots of research, medical research around the diagnosis and the therapy. But our informaticists is also our responsibility to do something to help these situations. So in China has the first country to report the cases. So actually, it's also the one of the country to conduct the medical researches on the COVID-19. So the first edition of guideline of diagnosis and therapy are published very early on January, and because it's a very urgency situation. So at the very beginning, there were very few knowledge around these diseases. So actually, with the time going on, with the knowledge accumulated, the the guideline has been upgraded very quickly. And now the seventh edition is the mature one and released around the March of this year. And also the seventh edition has been translated in English and being published on the internet. So what I'm thinking is at the same time, not only the Chinese version guideline, but also a lot of knowledges have been developed and being released and be shared, including some like the handbook of COVID-19 prevention treatment developed by Alibaba and some hospital experts. But the issue, the question is, those knowledges, they often use the different languages, and then they usually are narrative guidelines, and then needs needs to be interpreted by humans, and usually is prone to error. And also those are text-based knowledges are difficult to integrate with heterogeneous information systems, and it's harder to prompt the recommendation and alerts in time. So the idea is, can information technology to do something to transfer the knowledge in a digital way. So I've been working in around on OpenAI for years. So OpenAI actually it's a openly and shared information model around the electronic health record, and then not besides the model, it's also have a series of specification schema for complete electronic health record architecture, and it's vendor and technology neutral, and also the purpose is to improve interoperability and the knowledge transferring. So the main specifications of the OpenAI is the archetypes. Actually, it's open and shared models for the EHR area, and it's the model could be understandable, reusable, and shareable, and to improve the interoperability of COVID-19 related data. Now also, in OpenAI, the main is a guide. There are guideline definition language which provides a formal way to computerize narrative guidelines. So we are thinking to using these tools to develop the clinical decision support applications for COVID-19. So firstly, we needed to specify a guideline acquisition approach using these tools. And also, secondly, we will develop and simulate the shareable computer interpretable guidelines. So this is the flows of the approach. And so at first, we needed to create the guideline knowledge specifications, and it's usually done by the specialists and the informationists. And then we need to extract the key concepts and their relationships from the guidelines. And after that, the OpenAI archetype and the templates and GDL, the guideline definition language, will be used to model the concepts and the logics and the algorithm. And then those models and the rules should be validated before it can be released and disseminated. So it's the tool we have used to manage the knowledges around the COVID-19. We use the name of the tool is a Confluence, and mainly the 7th edition of the guideline, Chinese guideline, have been used in our study. So at first, we need to extract the concepts and entities from the guideline, and those entities need to be modeled as the OpenAI archetypes. So the method we use the traditional OpenAI modeling method. So actually, I will not go very detailed about how to model that. So the main point is to because there are very good knowledge bases of the OpenAI archetypes. It's open, it's a clinical knowledge management is shared in the internet. So at first we find the already agreed and shared OpenAI archetypes from the CKM, and if there are already existing archetypes, we just directly use them. If there are none of these existing archetypes, we will extend and to create a new one. And this work has been already published in JAMA, and also our work have been can be found in the CKM knowledge bases. After we have developed the model, then we needed to find and extract the relationship of these concepts. So we use the if-then relations to extract the information from the texts. And those if-then relationships, we use the GDL editor. It's developed by OpenAI Foundations to model these relationships and this algorithm to rules. That I will show some screen pictures to see how we model that rules. So firstly, we needed to import all the archetypes we have developed before, and then then we needed to data bind this already developed OpenAI models to the data elements. In this example, you can see these archetypes, the body temperature archetypes, can be data binding to a temperature data elements. Then the rules can be developed using this tool. So this example shows if the CT image report contains these features, and then the patient has a COVID-19 risk factor, and it has been developed and can be implemented in the CDSS further. So totally, we have developed 18 GDL rules. So it's including the suspected cases diagnosis, and the diagnosis, and also the clinical case classification, and later the discharge criteria rules. So all these rules can be covering all the process of the COVID-19 patients in hospital. And the rules can be are validated using some real patient data from the already published patient case report. And this rule, because in order to share this knowledge, so the purpose is to share this knowledge. So we have published these rules to the GitHub, and it can be found from this internet links. Using these rules, we have developing the clinical decision support tools. So as we all know, in China, actually, the COVID-19 has so far has been largely under control, and now, but there still have some small scale breakouts, like in Jilin, Guangdong, Beijing, and Xinjiang, and most recently it's in Qingdao. There are some small scale breakouts. So it's still very important for hospitals to screen COVID-19 patients now. So we have find two scenarios to use of clinical decision support tools. So one is in the clinics for doctors when they diagnose patient, whether they have the COVID-19 disease or not. The second scenario will be for the management department hospital. The staff need to screen all the cases to see whether there are some patients have been misdiagnosis. So these are the two scenarios we purposed, we targeted to use our CDS tools. So we have used the platform we have developed before. So actually, it's a little bit complicated platform. So I will not go very deep now. So it's named transport. It can be imported the developed rules, and also the UIs can be configured using these tools. And so using this tool, we have mapped the archetype, OpenAI archetypes to the. I'm sorry, so the slides already the switch automatically. So we mapped it to the Java objects, and also we mapped all the rules to the rules, because so far the GDL rules, there are no open source the GDL execution engine. So we still transfer the GDL rules to JAWS rules, because we can use the open source engines for JAWS. So the application has already been developed. The left one is a diagnosis support tools. The right one is we can screen all the patients in the hospital to see whether there are some suspected patients have misdiagnosis. So I will some discussions after our study. So we can find that because using OpenAI archetypes can save our time and lift our burden, because there are already in OpenAI community there are already over 600 OpenAI archetypes have been developed and shared among the community. So we can using them. Actually, currently we totally developed 27 archetypes. Most can be directly reused from the CKM. Only one archetype should be developed new. And also the GDL and the editor it's very convenient and easy to use to develop the rules for our application. But still there are some limitations because the GDL execution engine, currently there are no open source one. So we need to transfer to JAWS. And also the GDL editor still have some limitations, which have been confirmed by the editor's author, Dr. Rongcheng. So finally, I will wrap up our study. It's the evidence-based CDS knowledge are required because it's a very good tool for transferring the knowledge quickly. In our study, we proposed our approach to using the OpenAI existing knowledges about archetypes and using GDL to rapidly develop a computer interpretable guideline. Two CDS applications are under deployment in clinical setting now, so it's ongoing. It's ongoing on the clinical trial. So this is our team. So besides the members in our group, we are also thanks to Dr. Heather Leslie, who have worked together with us to model the OpenAI archetypes, and also Dr. Rongcheng. He's the GDL's author, and he helped us to develop the rules. That's all. Thanks for listening my report.